Question 1. A client with acute pancreatitis is admitted to the intensive care unit. During morning rounds, the nurse reviews the client's laboratory findings and physical assessment data. Which findings should the nurse recognize as complications associated with acute pancreatitis? Select all that apply. A. Serum calcium level of 7.4 milligrams per deciliter. B. Blood glucose level of 218 milligrams per deciliter. C. Gray Turner sign present on the flank. D. Serum amylase level returning to normal. E. Decreased hematocrit level. F. Abdominal distension with absent bowel sounds. The answer is A. Serum calcium level of 7.4 milligrams per deciliter. B. Blood glucose level of 218 milligrams per deciliter. C. Gray Turner sign present on the flank. F. Abdominal distension with absent bowel sounds. Rationale. Hypocalcemia occurs from fat necrosis binding calcium. Hyperglycemia results from impaired insulin production. Gray Turner sign indicates retroperitoneal hemorrhage. Paralytic ileus may produce abdominal distension and absent bowel sounds. Question 2. A nurse is caring for a client with left-sided heart failure. Which assessment findings should the nurse expect related to pulmonary congestion? Select all that apply. A. Orthopnea. B. Bilateral crackles in lung bases. C. Elevated jugular venous distension. D. Paroxysmal nocturnal dyspnea. E. Productive cough with frothy sputum. F. Peripheral pitting edema. The answer is A. Orthopnea. B. Bilateral crackles in lung bases. D. Paroxysmal nocturnal dyspnea. E. Productive cough with frothy sputum. Rationale. Left-sided heart failure primarily causes pulmonary congestion. Orthopnea, PND, pulmonary crackles, and frothy sputum are classic findings. JVD and peripheral edema are more typical of right-sided heart failure. Question 3. A client with SIADH, syndrome of inappropriate antidiuretic hormone, is admitted for evaluation. Which findings should the nurse anticipate when reviewing the client's laboratory results? Select all that apply. A. Serum sodium 120 milliequivalents per liter. B. Decreased urine-specific gravity. C. Increased urine osmolality. D. Low serum osmolality. F. Increased hematocrit. F. Concentrated urine output. The answer is A. Serum sodium 120 milliequivalents per liter. C. Increased urine osmolality. D. Low serum osmolality. F. Concentrated urine output. Rationale. SIADH causes water retention, resulting in dilutional hyponatremia, low serum osmolality, and concentrated urine with high urine osmolality. Question 4. A client with Addison's disease arrives at the emergency department with suspected adrenal crisis. Which assessment findings should the nurse expect? Select all that apply. A. Severe hypotension. B. Hyperkalemia. C. Hyponatremia. D. Hyperglycemia. E. Weakness and fatigue. F. Bradycardia due to vagal stimulation. Answer. A. Severe hypotension. B. Hyperkalemia. C. Hyponatremia. E. Weakness and fatigue. Rationale. Adrenal crisis results from cortisol and aldosterone deficiency, causing hypotension, hyperkalemia, hyponatremia, weakness, and possible hypoglycemia. Question 5. A nurse is providing discharge teaching to a client newly diagnosed with myasthenia gravis. Which statements indicate correct understanding of the disease management? Select all that apply. A. I will take my anticholinesterase medication before meals. B. I should schedule activities early in the day. C. Rest periods are important to manage muscle fatigue. D. I should avoid infections whenever possible. E. Increasing potassium intake will reduce muscle weakness. F. I will wear an eye patch if I develop double vision. Answer. A. I will take my anticholinesterase medication before meals. B. I should schedule activities early in the day. C. Rest periods are important to manage muscle fatigue. D. I should avoid infections whenever possible. Rationale. Anticholinesterase medications improve swallowing ability when taken before meals. Energy conservation, rest periods, infection prevention, and management of diplopia are important aspects of care. Question 6. A nurse is caring for a client with hyperkalemia. Which ECG changes should the nurse anticipate? Select all that apply. A. Peaked T waves. B. Widened QRS complexes. C. Flattened T waves. D. Ventricular dysrhythmias. E. Prolonged PR interval. F. U waves. Answer. A. Peaked T waves. B. Widened QRS complexes. D. Ventricular dysrhythmias. Rationale. Hyperkalemia causes characteristic ECG findings including peaked T waves, widening QRS complexes, prolonged PR intervals, and life-threatening ventricular dysrhythmias. Question 7. A nurse is reviewing medications for a client receiving warfarin therapy. Which findings require immediate follow-up? Select all that apply. A. INR of 4.8. B. Black tarry stools. C. Hematuria. D. Hemoglobin 13 grams per deciliter. E. Severe headache. F. Platelet count 210,000 per millimeter cubed. Answer. A. INR of 4.8. B. Black tarry stools. C. Hematuria. E. Severe headache. Rationale. Warfarin toxicity can lead to bleeding. Elevated INR, melina, hematuria, and severe headache, possible intracranial bleed, require urgent evaluation. Question 8. A nurse is caring for a client with tuberculosis placed in airborne precautions. Which infection control measures should the nurse implement? Select all that apply. A. Place client in a negative pressure room. B. Wear an N95 respirator mask. C. Use surgical mask when entering room. D. Limit transport outside room. E. Client wears surgical mask during transport. F. Place client in positive pressure isolation. Answer. A. Place client in a negative pressure room. B. Wear an N95 respirator mask. D. Limit transport outside room. E. Client wears surgical mask during transport. Rationale. Tuberculosis requires airborne precautions including negative pressure isolation, N95 respirators, and masking the client during transport. Question 9. A nurse is caring for a client experiencing hypoglycemia. Which clinical manifestations should the nurse expect? Select all that apply. A. Diaphoresis. B. Tremors. C. Tachycardia. D. Polyuria. E. Confusion. F. Blurred vision. Answer. A. Diaphoresis, B. Tremors, C. Tachycardia, E. Confusion, F. Blurred vision. Rationale: hypoglycemia activates the sympathetic nervous system, causing sweating, tremors, tachycardia, and neurologic symptoms such as confusion and visual disturbances. Question 10. A nurse is assessing a client with meningitis. Which clinical findings are consistent with meningeal irritation? Select all that apply. A. Positive Koenig sign. B. Positive Brudzinski's sign. C. Nuchal rigidity. D. Photophobia. E. Hyporeflexia. F. Severe headache. Answer: A. Positive Koenig sign. B. Positive Brudzinski's sign. C. Nuchal rigidity. D. Photophobia. F. Severe headache. Rationale: classic meningeal irritation signs include Koenig sign, Brudzinski's sign, neck stiffness, photophobia, and severe headache. Question 11. A nurse is caring for a client who is 24 hours post-operative following a total thyroidectomy. During the assessment, the nurse evaluates for complications related to possible hypocalcemia secondary to accidental parathyroid gland removal. Which findings should the nurse recognize as manifestations of hypocalcemia? Select all that apply. A. Positive Schwastek's sign. B. Positive Trousseau's sign. C. Perioral numbness and tingling. D. Hyperactive deep tendon reflexes. E. Bradycardia. F. Laryngospasm. Answer: A. Positive Schwastek's sign. B. Positive Trousseau's sign. C. Perioral numbness and tingling. D. Hyperactive deep tendon reflexes. F. Laryngospasm. Rationale: hypocalcemia increases neuromuscular excitability, producing tetany signs such as Schwastek's and Trousseau's signs, perioral paresthesia, hyperreflexia, and potentially life-threatening laryngospasm. Question 12. A client with sepsis is admitted to the intensive care unit. The nurse understands that early recognition of systemic inflammatory response syndrome, SIRS, criteria is essential. Which findings meet SIRS criteria? Select all that apply. A. Temperature of 38.6 degrees Celsius, 101.5 degrees Fahrenheit. B. Heart rate of 112 beats per minute. C. Respiratory rate of 24 breaths per minute. D. White blood cell count of 3,500 per millimeter cubed. E. Blood pressure 130/80 millimeters Hg. F. PaCO2 of 30 millimeters Hg. Answer: A. Temperature of 38.6 degrees Celsius. B. Heart rate of 112 beats per minute. C. Respiratory rate of 24 breaths per minute. D. White blood cell count of 3,500 per millimeter cubed. Rationale: SIRS criteria include fever or hypothermia, tachycardia, tachypnea or low PaCO2, and abnormal WBC counts, less than 4,000 or more than 12,000. Question 13. A nurse is reviewing arterial blood gas results for a client with respiratory distress. Which findings are consistent with respiratory acidosis? Select all that apply. A. pH 7.30. B. PaCO2 55 millimeters mercury. C. HCO3- 26 milliequivalents per liter. D. Hypoventilation. E. Confusion and headache. F. Kussmaul respirations. Answer: A. pH 7.30. B. PaCO2 55 millimeters mercury. D. Hypoventilation. E. Confusion and headache. Rationale: Respiratory acidosis results from CO2 retention due to hypoventilation, producing decreased pH and elevated PaCO2 with neurological symptoms such as confusion. Question 14. A nurse is caring for a client with deep vein thrombosis, DVT. Which interventions should the nurse implement to prevent pulmonary embolism? Select all that apply. A. Administer prescribed anticoagulant therapy. B. Encourage early ambulation once therapy begins. C. Massage the affected extremity. D. Apply sequential compression devices to the unaffected leg. E. Monitor for sudden onset dyspnea. F. Elevate the affected extremity. Answer. A. Administer prescribed anticoagulant therapy. B. Encourage early ambulation once therapy begins. E. Monitor for sudden onset dyspnea. F. Elevate the affected extremity. Rationale. Anticoagulation, monitoring for PE symptoms, elevation, and safe mobilization help prevent embolization. Massaging the affected limb is contraindicated because it can dislodge a clot. Question 15. A nurse is assessing a client experiencing increased intracranial pressure, ICP. Which findings indicate worsening ICP? Select all that apply. A. Decreasing level of consciousness. B. Projectile vomiting. C. Widening pulse pressure. D. Bradycardia. E. Dilated non-reactive pupils. F. Rapid shallow breathing. Answer. A. Decreasing level of consciousness. B. Projectile vomiting. C. Widening pulse pressure. D. Bradycardia. E. Dilated non-reactive pupils. F. Rapid shallow breathing. Rationale. Classic manifestations of rising ICP include Cushing's triad, bradycardia, widening pulse pressure, decreased LOC, vomiting, and pupil changes. Question 16. A nurse is caring for a client receiving packed red blood cell transfusion. Which findings suggest an acute hemolytic transfusion reaction? Select all that apply. A. Fever and chills. B. Flank pain. C. Hypotension. D. Dark urine. F. Chest tightness. Answer. A. Fever and chills. B. Flank pain. C. Hypotension. D. Dark urine. F. Rationale. Acute hemolytic reactions involve immune destruction of RBCs, producing fever, chills, flank pain, hypotension, hemoglobinuria, and chest discomfort. Question 17. A nurse is evaluating a client with hyperthyroidism. Which findings are expected? Select all that apply. A. Heat intolerance. B. Weight loss despite increased appetite. C. Tachycardia. D. Exophthalmos. F. Fine tremors. Answer. A. Heat intolerance. B. Weight loss despite increased appetite. C. Tachycardia. D. Exophthalmos. F. Rationale. Hyperthyroidism increases metabolic activity leading to heat intolerance, tachycardia, tremors, weight loss, and eye changes. Question 18. A nurse is planning care for a client with nephrotic syndrome. Which findings are characteristic of this condition? Select all that apply. A. Massive proteinuria. B. Hypoalbuminemia. C. Generalized edema. D. Hyperlipidemia. F. Weight gain. Answer.
A. Massive proteinuria. B. Hypoalbuminemia. C. Generalized edema. D. Hyperlipidemia. F. Weight gain. Rationale. Nephrotic syndrome is characterized by heavy protein loss in urine, resulting in hypoalbuminemia, edema, and compensatory hyperlipidemia.
Question 19. A nurse is caring for a client with acute respiratory distress syndrome, or ARDS. Which interventions should the nurse anticipate as part of management? Select all that apply. A. Mechanical ventilation with PEEP. B. Prone positioning. C. High-dose diuretics for fluid removal. D. Conservative fluid management. E. Low tidal volume ventilation strategy. F. Routine administration of bronchodilators only. Answer. A. Mechanical ventilation with PEEP. B. Prone positioning. D. Conservative fluid management. E. Low tidal volume ventilation strategy. Rationale. ARDS treatment focuses on lung protective ventilation, PEEP, prone positioning, and careful fluid balance to improve oxygenation. Question 20. A nurse is caring for a client with hepatic encephalopathy secondary to liver cirrhosis. Which interventions should the nurse include in the care plan? Select all that apply. A. Administer lactulose as prescribed. B. Monitor ammonia levels. C. Restrict dietary protein during acute episodes. D. Encourage frequent sedation for agitation. E. Monitor neurological status regularly. F. Assess for asterixis, flapping tremor. Answer. A. Administer lactulose as prescribed. B. Monitor ammonia levels. C. Restrict dietary protein during acute episodes. E. Monitor neurological status regularly. F. Assess for asterixis, flapping tremor. Rationale. Hepatic encephalopathy results from ammonia accumulation, so treatment includes lactulose, protein restriction during acute episodes, and frequent neurological monitoring. Question 21. A nurse is caring for a client with acute pulmonary embolism, or PE. Which assessment findings should the nurse expect? Select all that apply. A. Sudden onset dyspnea. B. Pleuritic chest pain. C. Tachycardia. D. Hemoptysis. E. Bradycardia. F. Decreased oxygen saturation. Answer. A. Sudden onset dyspnea. B. Pleuritic chest pain. C. Tachycardia. D. Hemoptysis. F. Decreased oxygen saturation. Rationale. Pulmonary embolism commonly presents with sudden dyspnea, pleuritic chest pain, tachycardia, hemoptysis, and hypoxemia due to obstruction of pulmonary blood flow. Question 22. A nurse is assessing a client with metabolic alkalosis caused by prolonged vomiting. Which findings are consistent with this acid-base imbalance? Select all that apply. A. pH 7.48. B. HCO3 32 milliequivalents per liter. C. Hypoventilation. D. Muscle cramps. E. Hyperkalemia. F. Confusion. Answer. A. pH 7.48. B. HCO3 32 milliequivalents per liter. C. Hypoventilation. D. Muscle cramps. F. Confusion. Rationale. Metabolic alkalosis occurs from loss of gastric acid, producing elevated pH and bicarbonate levels.
compensatory hypoventilation occurs, and electrolyte disturbances can cause muscle cramps and neurologic changes. Question 23. A nurse is caring for a client with acute myocardial infarction, MI. Which laboratory findings confirm myocardial injury? Select all that apply. A. Elevated troponin I. B. Elevated CKMB. C. Elevated myoglobin. D. Elevated serum amylase. E. Elevated BNP. F. Elevated lactate dehydrogenase, LDH. Answer. A. Elevated troponin I. B. Elevated CKMB. F. Elevated lactate dehydrogenase, LDH. Rationale. Cardiac biomarkers indicating myocardial damage include troponin, CKMB, myoglobin, and LDH. Question 24. A nurse is caring for a client experiencing anaphylactic shock following medication administration. Which interventions should the nurse implement immediately? Select all that apply. A. Administer intramuscular epinephrine. B. Maintain airway and provide oxygen. C. Establish large-bore IV access. D. Place the client in high Fowler's position if hypotensive. E. Administer antihistamines as prescribed. F. Monitor blood pressure continuously. Answer. A. Administer intramuscular epinephrine. B. Maintain airway and provide oxygen. C. Establish large-bore IV access. E. Administer antihistamines as prescribed. F. Monitor blood pressure continuously. Rationale. Immediate management of anaphylaxis focuses on airway, epinephrine, oxygen, IV access, antihistamines, and hemodynamic monitoring. Question 25. A nurse is evaluating a client with diabetic ketoacidosis, DKA. Which findings should the nurse expect? Select all that apply. A. Blood glucose 450 milligrams per deciliter. B. Kussmaul respirations. C. Fruity breath odor. D. Metabolic acidosis. E. Hypoglycemia. F. Dehydration. Answer. A. Blood glucose 450 milligrams per deciliter. B. Kussmaul respirations. C. Fruity breath odor. D. Metabolic acidosis. F. Dehydration. Rationale. DKA results from insulin deficiency leading to hyperglycemia, ketosis, metabolic acidosis, dehydration, and characteristic Kussmaul respirations. Question 26. A nurse is caring for a client with spinal cord injury at the T4 level who develops autonomic dysreflexia. Which findings should the nurse recognize? Select all that apply. A. Severe hypertension. B. Bradycardia. C. Flushed skin above injury level. D. Pounding headache. E. Hypotension. F. Nasal congestion. Answer. A. Severe hypertension. B. Bradycardia. C. Flushed skin above injury level. D. Pounding headache. F. Nasal congestion. Rationale. Autonomic dysreflexia causes sudden sympathetic discharge, leading to severe hypertension, headache, bradycardia, flushing, and nasal congestion. Question 27. A nurse is assessing a client with pernicious anemia. Which findings should the nurse expect? Select all that apply. A. Glossitis. B. Fatigue. C. Paresthesia of hands and feet. D. Macrocytic red blood cells. E. Increased intrinsic factor production. F. Memory impairment. Answer. A. Glossitis. B. Fatigue. C. Paresthesia of hands and feet. D. Macrocytic red blood cells. F. Memory impairment. Rationale. Pernicious anemia is caused by vitamin B12 deficiency, resulting in neurological symptoms, macrocytic anemia, glossitis, and fatigue. Question 28. A nurse is monitoring a client receiving heparin infusion. Which findings suggest heparin-induced bleeding complications? Select all that apply. A. Hematuria. B. Petechiae. C. Decreased hemoglobin. D. Epistaxis. E. Hypertension. F. Melena. Answer. A. Hematuria. B. Petechiae. C. Decreased hemoglobin. D. Epistaxis. F. Melena. Rationale. Heparin increases bleeding risk, leading to hematuria, petechiae, epistaxis, melena, and decreased hemoglobin levels. Question 29. A nurse is caring for a client with acute kidney injury during the oliguric phase. Which findings should the nurse expect? Select all that apply. A. Urine output less than 400 milliliters per day. B. Hyperkalemia. C. Metabolic acidosis. D. Fluid overload. F. Polyuria. E. Elevated BUN and creatinine. Answer. A. Urine output less than 400 milliliters per day. B. Hyperkalemia. C. Metabolic acidosis. D. Fluid overload. F. Elevated BUN and creatinine. Rationale. During the oliguric phase of AKI, decreased kidney function causes fluid retention, electrolyte imbalances, metabolic acidosis, and rising nitrogen waste products. Question 30. A nurse is evaluating a client with Cushing's syndrome. Which findings should the nurse expect? Select all that apply. A. Moon face. B. Truncal obesity. C. Hyperglycemia. D. Purple abdominal striae. F. Hypotension. E. Muscle weakness. Answer. A. Moon face. B. Truncal obesity. C. Hyperglycemia. D. Purple abdominal striae. E. Muscle weakness. Rationale. Cushing's syndrome results from excess cortisol, causing characteristic features such as moon face, central obesity, hyperglycemia, muscle weakness, and purple striae. And that brings us to the end of Top 30 Hard SATA Questions, Nclex Practice Test. If you were able to work through these questions without guessing, you're thinking exactly the way the Nclex expects, analyzing clinical clues, identifying priority findings, and selecting every correct intervention instead of stopping at the first good-looking option. Remember, SATA questions are not about tricks. They test how completely you understand the patient's situation. The more you train your brain to evaluate each option independently, the stronger your clinical reasoning becomes. If some of these questions challenged you, that's actually a good sign. The goal here on MCQs Master 101 is not easy practice. It's Nclex level mastery. Make sure you review the rationales again, pause and reanalyze any question you missed, and train yourself to think like the nurse responsible for the patient. Because on the real Nclex, the difference between passing and failing is often one clinical judgment decision. If this video helped sharpen your SATA strategy, don't forget to like, subscribe, and turn on notifications so you never miss our next set of high-level Nclex practice questions. And remember, the more difficult the practice, the easier the Nclex becomes. See you in the next Nclex Mastery session.